We will talk about kidney functions and tests in which we can determine if kidney is functioning well. Kidneys are organs in our body. They are bean-shaped. They are much larger than beans, but shape are similar. And kidney have several functions. First is filtration of blood, its main function, and remove waste products and toxins from our blood. And blood pressure regulation is another important function, and electrolyte balance. Our blood needs to be balanced always, because sometimes some electrolytes are high and sometimes low, and this electrolyte should be balanced by kidney secretion. And now let's see how kidney is functioning. Filtration. During filtration, urea and creatinine is filtered out in the kidney. This part of kidney is called glomerulus, and in glomerulus happens, and during this process, filtration process, also salts, sodium, potassium, glucose, water, and other products also are filtered out. So our body needs these components, especially amino acids, glucose, salts, water. Our body requires these components. That's why second process is happening, and it's called reabsorption. Our body reabsorbs and back to the body these required molecules such as amino acids, glucose, water, salts, and it happens in tubules, especially proximal tubules. It happens, this reabsorption process happens here. So first process was filtration, second process was reabsorption, and third process is secretion. And what is secretion? Secretion is, even after filtration and after reabsorption, some useful components still in the blood stays many toxins and drug products and drug metabolites, and we don't need these toxins and drugs, and we need to excrete them from the body. So here happens this. It is called secretion, and secretions happens in collecting ducts and distal tubules also. So first process was filtration, where we filter almost everything, including urea, creatinine, salt, sodium, glucose, amino acids, water. After this reabsorption happens. Reabsorption is back to the body these useful components such as amino acids and glucose and salt and water. And third process is secretion. Secretion is components which still stayed in the body. And now let's say about blood tests, and not only blood tests. First is most useful to assess kidney function is creatinine level. Creatinine level, as we said, creatinine is waste product, and we need to excrete it from the body. So if creatinine level is elevated in the blood, it means that we have kidney filtration problems, and it can indicate acute kidney damage or chronic kidney damage or glomerulonephritis or dehydration. Also, we have almost similar test which is called glomerular filtration rate. Glomerular filtration rate is calculated based on creatinine filtration, and it's calculated to consider patient's age, gender, body size, and it's derived formula actually, and it's calculated and it's more precise. Another test, we have blood urea nitrogen test. It's also waste product of the body and need to be excreted from the body, and if high urea in the blood, it means that we have kidney damage. Sometimes if person intakes too much proteins, urea can be increased in the blood. Also, if body is in catabolic state, for example after intense exercise, blood urea nitrogen can be elevated, or during starvation, for example prolonged starvation. Another test is urine test. Urine test is very useful, and in many cases it's cheap but very informative test. We can find in the urine bacteria, leukocytes. It can be sign of cystitis or pyelonephritis, so in urinary tract infection signs. We can find in the urine crystals which can be sign of kidney stones. We can find red blood cell casts which can be sign of glomerulonephritis. We can find proteins in the urine which can mean diabetic nephropathy or nephrotic syndrome or nephrosclerosis, or even during stress, protein can be elevated in the urine, and it can be totally normal if person is stressed, and usually it's only transient. But if proteins in the urine is elevated in prolonged period of time, then we should find problem, because there is always problem, and it can be early sign of kidney damage. Even we have blood urine nitrogen test normal and creatinine test normal, so it can be proteins in the urine can be early sign of kidney damage. And kidney ultrasound is very useful test, also imaging test. You can see cysts, tumors, obstructions, infection, kidney stones. You can see almost everything in kidneys during ultrasound. It's cheap and easy method, and in many cases it's accessible in many facilities. So kidney ultrasound is really important imaging test. CT scan is also important. It gives us detailed image of kidney, but it's more expensive, and also you get radiation during CT scans. That's why it's used less commonly compared to kidney ultrasound. And biopsy of kidney also important. At this case, tissue samples are examined under microscope. It happens during cancers, also during different diseases of kidney, to differentiate them and define best practice of treatment. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.